Hello everyone, I'm Dr. Sri Banerjee. As you know, chronic diseases come in many shapes and sizes. I've been lecturing about chronic diseases in many of my videos, but this one is specifically about and looking at a certain factor, a certain condition which worsens the outcomes of chronic diseases. So I've been focused on mainly looking at third factors. What I mean by that is looking at a primary risk factor, looking at an outcome, and then a third factor that kind of moderates, that kind of modifies, the more proper term is um, the uh, uh, the relationship between the primary variable and the outcome variable. So this is cachexia, and cachexia can be pretty severe. It's a complicated metabolic syndrome, um, which it's related to underlying illness and characterized by muscle mass loss. Um, so the epidemiology actually in cancer patients range from anywhere from 40 to 70%. So this is pretty high. And so in 20 to 25% of patients with advanced solid tumors, it's considered actually the primary cause of death. But this doesn't just limit to this condition to cancer, because this is looking at other chronic diseases like chronic obstructive pulmonary disease, COPD, chronic heart failure, chronic kidney disease, chronic infectious and inflammatory diseases, including AIDS. So this condition, it's a condition which seems like really has an etiology in cytokine release. So inflammatory biomarkers and a lot of other things cause this. And it primarily is a metabolic cascade, which affects it's weight loss, but it also affects kind of the hunger, things like that. Um, and so there's digestive factors resulting in poor intake, including nausea, difficulty swallowing, mucositis, and even constipation. So the tumor-mediated factors make this a lot more complicated. And so it's really important to understand cachexia. So what I encourage you to do, as you can see, I can't really access the content here, but what I encourage you to do is look at some questions related to this, because if you can identify common themes, then you can both understand it from a medical perspective and understand multiple chronic conditions. But simultaneously, you can look at this from an epidemiological perspective, a research perspective, and see that you can kind of take a look at it from that angle. So there you have it. There's kind of like there's various ways to look at this, and hopefully this has kind of helped guide you in understanding and evaluating this a little bit better. There's treatment management, and then this ends with some differential diagnosis. And as you can see, some of the common differentials for this, this is interesting list, is celiac disease, so this can act like this, Crohn's disease, cystic fibrosis, dementia, mercury poisoning, motor neuron disease, multiple sclerosis, multiple system atrophy, Parkinson's disease, and rheumatoid arthritis. So this is another way, by creating a differential diagnosis, this is another way that you can kind of explore your research area. This list will allow you to understand the common kind of symptoms which tie together all the different types of cancer, cachexia, and cachexia in general. And then here's this diagnosis of cancer cachexia, how it's diagnosed, which is very important in epidemiology. but also the stages of cancer cachexia. So as a researcher, you kind of have to make a decision as to how you'll define cachexia, and depending on that, on the diagnostic criteria, how that makes a difference in the research outcomes. So this is all there is really to kind of focus on with cachexia. If you want to know more, again, I urge you to uh, do a search, a detailed search, and look at all the articles and interventions that are behind this, and maybe even some meta-analyses. This is the pathophysiology and the epidemiology of cachexia. Thank you for listening.